In this video I'm going to show you how to choose your laryngoscope and a few different kinds. So these are all blades for the video laryngoscope I have here, which is a CMAC brand. There are others like GlideScope, and those are all very good. But I do like this one. It can be used just like a direct laryngoscope would be, meaning you can try to directly visualize the tracheal opening or the cords. But if that doesn't work, you have your video there. I typically would just use the video the whole time. But just like with direct laryngoscopy, there's different blades. As discussed in a different video, this is a hyperangulated, very curved blade that can only be used with video laryngoscopy because it goes so far anterior you'd never have direct visualization of the cords when using that. Now, in contrast to a direct laryngoscope, which I don't recommend using unless that's the only thing you're comfortable with. But if that's the case, then you should simulate and practice with the video laryngoscope until you're comfortable with it. And then this is going to ultimately be better once you're comfortable with it. Okay. So the direct laryngoscope, you have to have a direct line of sight between the oral opening and the cords in order to be able to place that endotracheal tube. Okay, so these are the different style blades. So these are all Macs, Mac, and Mac. Those are slightly curved, and these are designed in general to be able to lift up the epiglottis to provide your view. In kids, they have a little bit different anatomy, so in general we use, especially in the small ones, a Miller blade. Now, there are Millers for adults too, but this is nice because you can actually lift up the epiglottis. So this, in general, is going to go a little further than your Mac blade. This is going to go past the epiglottis to lift the epiglottis up. Now, whatever gets you a good view is great, but that's in general how those are used. Right now we're going to go through blade size selection. So on your smaller end of the spectrum, typically you're going to be looking at using a Miller blade. Now they do make Mac blades this small, but that said, typically the Miller is going to do a better job of allowing you visualization, because the way this works is the tip of the Miller blade goes past the epiglottis to lift it up that way, as opposed to a Mac, which goes into the vallecula, which is the area just before the epiglottis, and tries to lift it up that way. So with Miller blades for babies, the 0 is one that will work for newborns and even most premature babies. There is a Miller 00 for your smallest babies, but this one actually works for most situations. Then by the time you get to about 2 to 3 months of age, then typically I'll switch to a Miller 1. And then this one works quite well up to about 2 years of age, at which time I'll switch to a Mac 2. Now you could consider using a Miller 2 at that age as well, but this one works really quite well at that point. And the Mac 2, it will actually work pretty well just until about adult age, which is, really adult size, get to about 12, 13 years of age. And then beyond that point, a Mac 3 really works pretty well for almost everybody, with the exception of some special circumstances. For example, difficult airway with anterior airway, D-blade, also known as a hyperangulated blade, is a very good option. Now, they do make bigger blades as well. So there's a Mac 4, and they even do make a Mac 5. I've never used a Mac 5, but there are some people who do prefer the Mac 4, and it may have some advantages in your really big adults. But that said, you might even wonder why not just use the longer blade and just not go in as far. Well, the real reason for that is because the curvature is different. So just comparing a Mac 3 to a Mac 4, you can see that the upward curvature occurs earlier and more abruptly with the Mac 3. And here's even a more sharp contrast here with the Mac 2. Now, they do have Miller blades that go all these sizes as well, and some people do prefer those, but in general, if I had to put together a kit, I would choose a Miller 0, a Miller 1, a Mac 2, a Mac 3, and then a D blade or hyperangulated blade. Although you may consider adding a Mac 4 because a lot of people, well, at least some people do like that blade as well.